is Professor Sebastian Hassler, who is the Director of Neuroelectronics Research Flanders, or in short, Nerf. And Nerf is an interdisciplinary research center that uses state-of-the-art equipment to study the brain at a very detailed and specific manner. So yeah, welcome, Professor Hassler. And yeah, go ahead.
Good. Sorry if I was pushing. Well, first of all, thanks for having me. And I should say that maybe a little disclaimer, we're a research institute, so now we're going to get a lot more technical. I hope that's okay. And we have absolutely no product on the market, and we're very far from a product anywhere. However, what I'd like to share with you is, of course, a bit our vision, the way we think we approach the problem, and then also illustrate this with two projects which are at different stage of development. And let me just jump right in. So, I think everyone's aware that brain disease is a problem, but I want to actually, this is not working. Yeah, it's not working. That's not good. So I'll tell you just then. So normally this number, which is now 8 billion, would actually go up to 700. And so this is to illustrate that the cost of brain diseases, and this is psychiatric disorders, but normally there was supposed to be a lot of other diseases listed. So the cost of brain disease in Europe alone is actually 800 billion or 700 billion. And in fact, this is the number from 2011, which means that now it's already quite higher. And this illustrates that beyond the individual suffering of patients, there's also gigantic societal burden. And so we need to do something. At the same time, it's very hard to do something because the brain is a really complicated thing. And to illustrate this, I just basically zoom in here at the different levels of organization, so you appreciate the crazy complexity of this thing, where you have like genes regulating, regulatory RNAs, proteins, different levels, synapses, neurons, that all will then, come together in circuits, and the activity in these circuits is actually what makes you behave. And we at Nerf, we're convinced that understanding these circuits and manipulating these circuits is actually, or measuring those circuits is actually critical, because if you think of Alzheimer's, for example, patients don't go to see a doctor because their brain hurts or because they feel, oh, there's some funny plaques there. No, they go to the doctor because they forget. Now, forgetting is not a biochemical thing. I mean, eventually it involves biochemistry, but forgetting in the first and maybe foremost part is actually that somehow the computer doesn't work properly. And so if you want to fix this, we believe that it's important to actually measure it, at least. And then, of course, DBS is a beautiful example and the best example of where actually sensing and manipulation can actually really then alleviate symptoms. Okay, so this is what we do. And because there's still a little problem, which is, okay, you say, well, just need to measure the neural circuits, but then they're very complicated. And in humans, there's limits to what you can actually do in terms of measurements, which is why we work in animal models, and we do systems neuroscience to really study in mice and rats how the brain functions while the animals are doing things. And because this often brings difficult measurement problems, we also engage in neuroengineering, where we develop tools to make better measurements, but also, of course, eventually to develop tools that will eventually make it into the clinic. So this is really our mission statement. And well, then you could say, well, what should we actually build? If you're an enthusiastic neurotech student, what is the thing you should build? And so I've put here a little overview which tries to simplify the problem a little bit with just 3 axes. So there's one thing which is, of course, you want to cover as many. Is there a laser pointer on the thing? Yes, okay. You want to cover as many neurons as possible, which is, you want to get as much information from that machine as possible. So you want to be here. At the same time, ideally, the whole thing is wireless. No wires, that's also what you want. And then there's this thing I call biomechanical compatibility, which has a lot to do, which is actually a very hard thing, and it has to do a lot with, like, if you want to interface with the brain and you open it up, the brain is extremely soft, and so you want to make sure that you're not destroying things and that things that you put into the brain stay intact for a long time. And so the ideal thing lives here. Okay, if this is what you want to build, go for it, but we cannot go there in one go. In fact, a lot of innovation is needed, and this is maybe a bit too technical, but a lot of innovation is needed to make the ultimate device, and that involves, you know, better compute, but also flexible substrate electronics and so on. Now, at the same time, of course, small details, you want to be able to stimulate with electrical or optical or acoustic, and of course, you need to keep a low energy budget and low thermal budget. And I think from this, what you can already appreciate that, you know, building the ultimate brain-machine interface is actually really not easy. However, in recent years, I think there's been really fantastic progress. And I want to highlight one of those projects, which is the result of a very large collaboration, including our institute, but a lot of others, which are also listed here. And that is the so-called neuropixel probe. It's a needle-type device, which is actually a CMOS-based technology where you have little needles that you can stick into the brain of an animal, for example. And then you have on the back end here, you have all the digitization and all this kind of stuff, so you can actually get just one wire coming out into your computer. And what's very nice about this is that actually, because it's based on CMOS technology, you can make many of the same devices with high quality, so manufacturing is kind of solved. And so here you see an example where we put 2 of those in a mouse, and the mouse is happily running around with this thing, and we're actually measuring more than 2,500 single units, which is, I think, currently a record. And so this is a really nice technology, and I should say that actually for humans that's a little bit overkill almost. So it has been used in humans already, but then actually they had to make these needles a little bit thicker so that they don't break so easily. So you can see that you need to keep, as an entrepreneur or engineer, you need to keep the application in mind as well. But for research, this has really changed the way we do physiology in animals. And I should also say that this is a project that was engineered and all designed and engineered at IMEC. And last but not least, I should also advertise my postdoc who did this work, who actually made it to the final round of the EOS pipette competition. So please vote for him. He's really good. Okay, a little bit of advertisement as well. Now, so I would argue in my scheme here, the neuropixels are here. We have an extremely high neuron coverage, but we still have, you know, basically 1 wire per electrode. So we're still not wireless. And I'll now illustrate the second project we're working on, which is working on a different end, not so much on increasing neuron coverage, but actually trying to be more compatible with the brain, and that's a flexible sheet electrode. And just one quick, basically, word of background. So these electrodes are called also ECOG electrodes, and they're currently used in the clinic. Here's an example of this. You can see it's a quite crazy piece of thing that they put on the brain, lots of wires, and it's very big. And so there's quite some limitations with this current technology. It's used actually in severe epilepsy cases to monitor epilepsy and origins of epileptic seizures. And so, but the conformability is something that's somewhat limited. The electrode density, as you can see, is somewhat limited. And the reproducibility is also, in at least current, not on the things on the market, but let's say on the research stage technologies, the reproducibility is always a bit of an issue. So you can think of this as a bit like concept car science, where you make this crazy, awesome thing, works once, but there's no way you can ever make it into actually manufacturing. And a lot of the research stage projects are in that stage. At the same time, there's clearly the vision in the field that having the very highly conformal, high-density devices would actually be very useful. So I was running around IMEC, and then of course I thought like, oh, they have so much cool technology here, and then I came across thin film transistor platforms, which is actually the backend for the TFT display. And everyone knows these displays, but I thought not of displays, I thought of ECOGs, of course, being a brain person. And so we thought, let's make an ECOG, which based on this technology platform. Because with the advantage that this thing would actually be manufacturable, because the display industry has already invested tons and tons and tons of millions into actually making a fabrication process, and also because it's pretty mature in terms of fabrication and all that. And so what we did is actually we make these foils, which are 20 micron thick, but we're also working on making them even thinner. Then we have made a chip that's actually done at IMEC, of course. This is also done at IMEC. And then we have the added value that actually with this technology, because there's an electrical circuit in the foil. It's not just a passive device where you have electrodes and a wire, but you actually have an electronic circuit. So essentially, there's transistors in there. Because of that, we can actually do things that such as addressing, where we can choose which electrode to record from, or we can do time division multiplexing, which means we can increase the number of recording sites at lower expense to the number of wires that come out of this device. And so this is just the very first experiments actually where we can show that we can do time division multiplexing both for spontaneous and evoked potentials in a rodent. And so I think it's an extremely interesting technology platform because the fabrication is already solved essentially. It doesn't mean that it cannot be improved, but there's no major hurdle. And then with the right chip, you'll be able to create arrays that have up to 16,000 channels, no problem. Okay, so then of course I'm very proud because with this I think we can get here. So we have lower neuron coverage, but we are closer to the ideal flexible floating thing, but we're not wireless yet. Okay, so and now I want to actually, this is the last project I want to illustrate. This is really a bit more like crazy science, but I want to bring it here because I think it illustrates, it addresses another very important challenge in neural interfaces that I think today people are not really tackling much, or not enough maybe. And so the problem is the following. If you stick an electrode into the brain, you'll pick up a dipole, sure. But we know the brain has a lot of neurons, but these neurons come in different flavors. So there's some that get activated, there's some that get not activated, there's some that get inactivated, and they're all connected in some complex ways. And each one of these neurons has a unique molecular profiles, and there's classes of neurons. And the problem is, when I'm just measuring dipoles, I have absolutely no idea which of the many neurons in the brain I'm actually currently listening to. However, in order to make sense of the information, you would kind of want to know if this is an excitatory neuron, an inhibitory neuron. Also for brain-machine interfaces, if you want to interface today and you have an electrical simulation like in DBS, it's beautiful. But of course, if you want to have meaningful stimulation, such as, for example, creating an image in the brain, you would prefer to actually provide the information to the right neurons in the right time, because of course the brain acts in a temporally spatial controlled manner. So, long story, so what we try to do is actually functionize electrodes, so make them, code them essentially with proteins that we know from developmental biology are actually able to induce formation of a synapse. So this is kind of a bio-nano hybrid kind of thing. So you have an electrode, this is a particular electrode, but doesn't matter really. And then we code these electrodes with these proteins. And then when there's a neuron walking by, sees the electrodes like, oh cool, let's make a synapse. So that has actually then makes a synapse with the electrode. So you have a synapse, I call it synaptoid compartment because not, of course, a really fully functional synapse. It's actually connecting then to these neurons, and then you get these very nice pictures where, in this particular example, the neuron connected to the electrode, and it almost looks like it's pulling it out of this, which is not good for the measurement. But okay, so this is really, I would say, the more far-out vision, but at the same time, I think addressing a really critical challenge in the field, which is like, how do we get selectivity into the stimulation? And with this, I'd like to end, and I'd like to briefly show my team because they're really amazing people and really fun to work with. All right, I'll be outside the booth, and so if you have questions, come bombard me with them.